So good morning, everyone. Thank you all for being here. We'll give everyone just a couple minutes to filter in, but happy, marvelous Monday. It's a gorgeous day here in New Hampshire. We were just talking about sort of a resurgence of summer with a bit more humidity, although rain on the way, which is, certainly much needed this year. So we're happy to be back again today for another chamber exclusive. Today, we welcome Dr. Bill Brewster from Harvard Pilgrim Health Care and are very excited. Bill and I had a great conversation at the end of last week and are really interested to hear from your perspective all that's happened through this time, what your background looks like, where things are headed from here. Do remember, everybody, that you're welcome to ask questions. If you hover over either the bottom or the top of your screen, there's a Q&A button, so you can put questions over to me and I'll field those after Bill gets through his opening remarks. So with that, I will turn things over to you. Thank you for being here.
Thanks, Kate. Thanks for having me, and thanks everybody taking time out of your day to join us. I think I'm going to go quickly over who I am, where I've been, Harvard Pilgrim, where it is, who they are, some of the pre-COVID things that we've been doing, post-COVID. Certainly, I think people are interested in that, although I keep hoping I'm going to wake up from a bad dream. I just couldn't have ever imagined in my wildest dream that this would ever happen, although it's not surprising. A future for Harvard Pilgrim, where we're headed. Some of you may have heard about us working to combine with Tufts Insurance. And then I'd really like to have some questions at the end to have it be more about just you and not necessarily all my ramblings. I have been told I ramble, so again, apologize. So a little bit about me. I'm originally from New Hampshire, born in Franklin, New Hampshire. I grew up in a wonderful town called Hill, New Hampshire. Didn't realize that people couldn't just wander around, do whatever they want, go fishing, go hunting, go swimming, ride bikes, and not be fearful about traffic or the other kind of things that a lot of people have to deal with. My wife's from Brooklyn, New York, and playing in the street happened, but it wasn't as safe as it was playing in the street in Hill, New Hampshire, where a car might go by every hour. I am a physician. I trained as an internal medicine doc. Having grown up in Hill and Franklin, we had a couple of general practitioners that were my physicians. One was Dr. Kropp, who actually had a storefront right on the main street. And if you couldn't get an appointment, you needed to get in sick quickly. It was back in the day, the version of urgent care, where you could go in, get seen, walk out with a little white packet of pills with take 3 times a day on the side of it. And I also had my general practitioner who was a prisoner of war in World War II, and just was, I don't know whether it was that experience or whatever, just the nicest man on the planet. And since I liked science and math, figured, well, gee, that seems like a good thing. My parents, of course, finding out that I was interested in being a physician, were very supportive about that. I mean, they wanted to have a doctor for a child, even though neither of them had any clue, nor did I, what it took to be a physician and what kind of education other than going to college. So decided I was going to be a primary care doc like the two of them, went to the University of Vermont, trained at George Washington University in DC, did my residency in DC, and met my wife there from Brooklyn. And because the National Health Service Corps had paid for 3 years of my medical school, I had borrowed the first year and figured that wasn't a long-term plan. We were actually the second most expensive school in the country at the time. And so I paid back the National Health Service Corps on the Canadian border in Vermont, and then moved back to the metropolis of North Conway, New Hampshire, where I had a private practice for about 7 years before figuring out that, again, the money in medicine really got in the way of me doing what I wanted to do, which was to really be able to treat anybody no matter what kind of insurance they had. But having to pay the salaries of my staff, pay for their health insurance, all the other things that go into running a business, I really decided at that point I wanted to get out of the business of medicine, and I took advantage of being recruited to Rochester, New Hampshire to start one of the first employed physician practices in New Hampshire at the time. I practiced there for a number of years, and then about 8 years ago, a little over 8 years ago, it was 8 years ago this March, maybe a little before that, the current medical director at Harvard Pilgrim said at one of our meetings, where Harvard Pilgrim, we have medical director meetings, and I had to go to those to hear what Harvard Pilgrim was doing. And he said, you should apply for my job. Nobody knows, but I'm going to be retiring. Well, at that point, I had no clue what somebody did who was a medical director for an insurance company, nor did I have any interest at all of going to work for an insurance company. I had been negotiating contracts against the insurance companies, what I called against. But Harvard Pilgrim, being the only nonprofit group insurance coverage carrier in New Hampshire, just seemed different. I knew the people that worked there. They were people, they lived in New Hampshire, they made decisions about New Hampshire. So I said, all right, I'll give it a chance, and did actually ultimately go to Harvard Pilgrim, again, 8 years ago, this last March, as their medical director. Medical directors typically work with providers to bridge that gap between paying claims and providing care, and create programs that actually reward people for doing quality care, explain some of the policies that we have, work on innovative ways to work together. We, as Harvard Pilgrim, gives out over $1 million in grants, quality grants every year, to do projects like hire a nurse practitioner to be embedded in a primary care practice and take care of mental health issues. So we've funded those. We've funded other kinds of issues that really there is no money to develop a program. We'll help start a program for primary care. So that was my job for 4 years. And then after 4 years, was promoted to become the vice president of operations for New Hampshire. It was a big chance. They've never had a physician run one of the states. So I was very honored that they would even consider that. I did have some business background. I'd been on the North Conway Memorial Hospital board. I was on the finance committee. I was on the Rochester Frisbee Hospital board on the finance and executive committee there. But when I was in Rochester, my wife and I had started to have some problems with one of my children. Issues in school. Some of you know that it snowballed into eventually heroin use, eventually an overdose at my wife's hospital, at my hospital in Rochester, just a regular nightmare. So we had really tried to have Joanne, who was an ICU nurse, not work much, so she could be home. We knew where the kids were. We really tried to ride herd over everything. I can tell you that's not enough, but we did do that. And as part of that, I also knew we had to save for retirement and we had to save for college. And so having just a single income as a primary care doc wasn't enough. So we started a fuel oil company. So I'm sure it kept my CEO and my CFO and everybody else at the hospital, because I was on the board. I was, working at the hospital. It must have made them stay awake at night wondering what screw up I was going to be involved in that would end up in the Fosters. And Dr. Brewster, who works at Frisbee, had a toxic waste spill or something. But we did well with that. We ended up selling to Eastern Oil and Propane. So again, I guess long story short, it helped me have an idea of the business side of things, what it took to run a business. The first chamber membership I ever had was with Best Oil. And one of the coolest things about it was the Christmas parade, where we got to decorate one of our trucks and my kids were on it and threw out candy. I mean, what could be wrong about throwing out candy? So that was my first chamber experience. So again, coming here to Harvard Pilgrim, just a little bit about Harvard Pilgrim. We have about 150,000 lives that we cover in New Hampshire, about 1.2 million lives across the 4 states and nationally. So we do have national business as well. We have subsidiaries. We have a self-insured, it's called the TPA, in health plans. And we have other subsidiaries as well. We cover just about every kind of insurance. We cover regular group insurance. We are one of the 3 companies that provides individual insurance on the exchange and off exchange. We cover Medicare Advantage. We cover MedSup. So pretty much cover all the different types of insurance other than Medicaid in New Hampshire. As I said before, we are a nonprofit. We're the only group carrier that is a nonprofit. Because of that, it gives us a little flexibility, and I don't answer to shareholders. I don't have the stress of having to meet that margin, as well as be able to put on the lights and pay for employees. So I have the benefit of that. And again, just we really are allowed to live up to our mission, which is to pay claims, but also partner with providers to innovate, to do things differently that might benefit our members. Pre-COVID, you just heard about that. We were the second largest group carrier in New Hampshire. I won't mention number one, you probably know. Yeah, we were the second largest group carrier and have been, really active and been in New Hampshire since the mid 90s. And I think, again, my hospital was the first one to contract with Harvard Pilgrim when they left or moved out of Massachusetts and started to write business in New Hampshire. The company has been around for 50 years. This is our 50th birthday. And our foundation, which is our charitable giving arm, has been around for about 40 years. Harvard Pilgrim was started by docs as a HMO in Massachusetts. So we don't come, it's not unreasonable that they have a clinician running a company that was started by physicians. It's just different. All of a sudden COVID hit. Now, it was not boring before COVID, but when COVID hit, the first thing was, how do I make sure that my employees are safe? We had a lot of meetings in Massachusetts. We have an office in Wellesley, we have an office in Quincy, we also have an office in Portland, Maine, we have an office in Hartford, and our office in Manchester. Our self-insured arm health plans has an office in South Carolina, as well as Florida, California. What was I going to do to make sure my employees in my office, and we have about 40 something people that work in the Manchester office right on Elm Street, what was I going to do to keep them healthy? But at the same time, what was I going to do to make sure that we could pay claims? We were going to have sick people coming in. We didn't know how many sick people, but we knew we were going to have sick people coming in. How was I going to keep them healthy, do our job, work with brokers, work with our members, not have anybody feel any different, but make sure that my employees didn't die because of something that was work related. So we closed our office early in March, all of our offices. I had been nervous because I could see it coming when I saw what was going on out in the Northwest and how long this disease could incubate before people knew they were sick. So they would be out in the public not knowing they were sick and spreading it. It felt like a tidal wave that was going to be coming. So I had worked with our IT people, our HR folks, and I said, guys, are you sure? Are you absolutely sure that if we have to close all of our offices, which my CMO and I thought we would have to do, we're ready to not have us be out of business. We need to be able to do what we normally do to pay providers, to make sure members get care, they get questions answered. We have always had a policy that if it was a horrible snowstorm or whatever, we would close and work from home. Leading up to the date that we closed, I had people bring home their laptop so that we could work remote. I had them bring it home every night saying, I don't know when the next day is that we might be closed, but be ready. And so we literally, the day we closed the office, we made the decision on Friday not to come in on Monday. I don't think, and maybe some of you will have questions or concerns about it, but I don't think we missed a beat. We were able to be up and live and running. We had Zoom calls. I've heard Blue Jeans, other names of things that I've never heard of before, as well as WebEx, Skype, and got pretty facile about being able to do it. Yeah, you're on mute. It was probably the number one thing that I heard because, and I would forget to unmute, but everybody else would forget to unmute. And you could see the lips moving. And as much as I'm a good lip reader, it was helpful to have audio. So we got better at it as we moved on. One of the other things as a clinician that I wanted to make sure we thought about was to get out of the way. I tell everybody the money that comes into, as far as premiums, not our money. It's your money as a business owner. It's our members' money. What they pay is their part, the individuals who pay for their insurance. So we have to be careful that we spend that money wisely. There has to be some value to what we're spending it on. There has to be some proof, evidence somewhere that that drug or that procedure is the right one at the right time. But on the other hand, I knew that with everything that was going on, the last thing providers need to worry about and members needed to worry about, that was my biggest concern, is how much it's going to cost. So people delaying getting care when they're sick and spreading COVID in the meantime because they're afraid they can't cover their copay or their deductible was just a huge issue for me and for the company. And so early on, we decided no copays, no deductibles, not only for the governor issued mandates around testing, but I think we may have been one of the first to decide without a mandate to not have any copays or deductibles for actual inpatient care. So the treatment of, or outpatient care for the treatment of actual COVID. So again, no copays, no coinsurance, no deductibles. We just wanted to make sure people got care. We also got rid of all of our prior auths and pre-certifications and all the other may-Is that we actually have people go through to let us know, A, that somebody's in the hospital, so we're ready when they come out to help manage them, but also to make sure that it's appropriate that someone's admitted to the hospital rather than having it done outpatient. So we got rid of all of the prior auths, all of the utilization management things, the permissions, the other may-Is early on. We wanted to make sure that we were a source of information, not only for our members, but the public. If we had access to information about COVID, we wanted to make sure people had it. So I worked with the New Hampshire Hospital Association. I worked with the Medical Society. We developed a website that had all sorts of helpful information, links to the CDC. We were meeting with the insurance department at least weekly, sometimes more than that, to make sure that we were responding to anything they'd heard that was less than ideal related to us. Fortunately, I didn't get a lot of screaming and yelling, but one of the good things that came out of COVID is we realized that we needed each other. And the Hospital Association, the Medical Society, and us, all of us together, working together to make sure that we figure out how do we all survive this and how do we make sure our members get the care that they need. We also knew that mental health was going to be a huge issue. It's a lot of stress. I mean, people are losing their job, being afraid of dying from COVID, just the general out of control feeling that I think a lot of us had. So free to the public and our members, we developed mindfulness programs that you could go online. It didn't have to be a member. Yoga programs. I think Kate and I talked about taking advantage of some of those. We made sure our employees had access to childcare information, coping skills, again, to try to help people through something that wasn't as simple as, oh, we'll just work from home. I have a very young workforce, and a lot of them are moms. And we just basically plunked ourselves down in the middle of their life. Mom and dad were usually home, not necessarily working. Now they're home, but they're working. They have kids that aren't in daycare because the daycare is closed. They have all sorts of pressures. And so we really wanted to make sure that our employees knew we were there for them. We tried to design different incentives to pay people to actually get out and exercise. Again, I was on them all the time, probably more than they wanted, about scheduling time during the day to take time to be with your kids, take time for yourself. So again, we did a lot of work around that. And then in the middle of it, we knew that people were struggling. Nonprofit organizations were struggling. Our members and other people were struggling, people who weren't our members in terms of food, access to food. Employers were struggling because they were shut down. They wanted to cover their employees to make sure they had insurance, but at the same time had a cash flow issue. So with our foundation, our charitable foundation, we gave, since COVID, about $1.3 million in New Hampshire. We supported independent practices with grants to the independent practices who weren't owned by hospitals. I believe it was around $8,000 each to help them buy the new expense of personal protective equipment. We helped 40-something nonprofits with donations of $10,000 plus to them. We donated $100,000 to the food bank. We donated to the United Way COVID fund, and really tried to empty down our coffers to get the money back out to people when they needed it. We also worked with a large restaurant chain to put some of their people back to work, and we supplied food for families in transition and New Horizons in Manchester. We gave $250,000 grants to 3 federally qualified health centers. We gave to Harbor Homes, was one of them, in Nashua, to try to support them in the middle of this crisis where they just have to be providing care no matter what, no matter whether they're getting paid or not. So really tried to work on that. We saw a huge claims drop off in April into May. The hospitals were mandated to keep beds ready for care. Things that were elective, like knee surgeries, other expensive kind of procedures, were put on hold if it wasn't life-threatening. And again, I try to explain to people, unlike the auto insurance industry, though, it's not like those claims aren't going to come back. I mean, the hip surgery that didn't get done, if there was a reason to do it, it's going to have to be done at some point. With the car insurance, you're not going to go out and try to catch up. Gee, I didn't have a car accident, so I'm going to drive like a crazy person and get in a car accident. There isn't a pent-up demand for car accidents. So we also had to budget for that excess claims above historic average as we came out of this. So it was a huge balancing act that our actuaries and underwriters were just, I don't know how many crystal balls they had going, but to try to figure out what we were going to do. Throughout this, we knew that companies were struggling, again, trying to keep their members covered. So we got rid of a lot of the underwriting rules about people having to work full-time to be able to have insurance. We had up to $2 million worth of premium deferrals for companies who asked to delay premium, and we would allow them to delay premium for a month or two and then start back up and spread that the premium they hadn't paid over several months. We advanced money to a couple of small hospitals that were struggling, and we basically said, look, historically we would have paid you this much, so we're going to pay you that much now, even though you haven't billed us for that because you haven't had the business. And then gradually over several months later, we'll let you sort of pay that back in terms of we won't pay for some of the claims you put in to get that money back. I think we really tried to go out of our way to get money back to people. We also deferred, we gave a premium credit for April premium, 15%. For anybody with group insurance, we were able to give money back for that April premium when we saw our claims go down. There are rules about how much money anybody can make in New Hampshire. If we spend less than 80 to 85% of the premium dollar that comes in, we're required to rebate, but that's something that happens like a year down the road once all the claims have come in and we figured that out. We wanted to make sure that we gave that rebate early on when people actually needed it, which was during this time. We saw telemedicine skyrocket. I was joking with the insurance department at one point. They asked how our telemedicine was going, where people can either through an app on their phone or through a Zoom conference call or whatever, get medicine virtually, medical care virtually. And at one point I was able to say in April, we had a 7,000% increase in telemedicine visits. But when it's 7,000% over 40 something claims, it's probably not as big a number as that 7,000% says. So we went from very, very, very few virtual visits to a lot of virtual visits. I mentioned earlier about 70% replacement of claims on the medical side with telemedicine when the offices were shut, and about 105, 110% actually of visits, partly I think due to increased demand. I mean, this is very stressful, going through COVID with all the stuff that's going on that we all have to deal with every day. So there was a demand for mental health services, but also there were a lot of people, from talking to some friends of mine who are mental health providers, who would never get care before. They were too embarrassed, there was a stigma, there was whatever, and now they could do it virtually. It's a little less scary when you don't have to be walking into an office going, I don't even know what's going to happen when I get in here. And I don't know who's going to be in the office who will see me. God forbid they know. I mean, I hear my patients used to share all sorts of personal medical information about the procedure they had, their colonoscopy, their whatever, things that I'm going, oh my God, I can't believe you're sharing that personal information. But mental health stuff, most people don't volunteer that. So the ability to do video visits, to do telephonic visits if people don't have internet access, the ability for teenagers to do a Zoom call with their adolescent mental health provider, all of those things were great. And I hope they continue. I know there's a law that's been passed to continue paying telemedicine on par with regular visits. We've extended our no copay required, no member liability for those kinds of visits. So I think that was a huge help. We've seen some issues though. We've seen vaccines drop off. My director of network contracting, the person that directs all of our contracts with providers, is also the chair of the state vaccine board, which manages the vaccines for kids under 18 that the state provides free. And they, like us, we've all seen about a 70% drop off on immunizations for kids. That's a huge issue. Um, Kids need to get their immunizations, but I understand it. I was always leery of bringing my children into the pediatrician's office, and hopefully there aren't pediatricians on here on the call that'll take offense. But no matter how much you clean that office, there's sick kids in there. They're spitting on stuff. They're sharing toys. I just sit in the chair. I'm like, oh my God, I'm going to get sick by being here. Well, in the middle of COVID, I can understand parents going, look, I have a baby and they're healthy. Why am I going to bring them into some place with sick people? So we've been working with providers to try to get the information out that there is a safe way to get immunizations. There are days when it's just for well child visits. We've really tried to be creative, and we've started to see immunizations come back up. But we had one child in Massachusetts, maybe because of missing an immunization, but had whooping cough, which is part of a pertussis tetanus shot that normally we all get. Had pertussis or whooping cough, which can be life-threatening in really small children, as well as COVID at the same time. So we've been working really hard with the medical society, with different provider organizations, with mailings to try to get people to get out there and get their kids vaccinated, which has been a huge, huge issue for us moving forward. Claims now are actually about 10% higher than they were last year at the same time. So we've seen the pent-up demand start to come back. Probably sharing proprietary information, so just all of you promise not to be sharing with our competitors, but we aren't necessarily seeing the number of cases of people coming in to get surgery, but the sickest of those people are coming in. So the cost per claim is dramatically higher than it would have been last year. We've had one claim recently in New Hampshire for a COVID patient that was $1.6 million. That one claim accounts for 3,000 of our members' total monthly premium. So when we have 85,000 fully insured lives in New Hampshire, one case of $1.6 million is immense. They needed the care. It was appropriate care. They got all sorts of things, including being put on bypass like they would have if they were having bypass surgery. But again, the claims have been dramatic. Now we're starting to see the hips. We're starting to see the knee surgery. We're starting to see back injections. Those things that before had been considered elective come back. And we expect that for a while, barring a second huge wave of COVID, which I'm worried about, we expect that, again, a lot of that just needed to be done on top of the usual cases that needed to be done. I'm going to just finish up because I'd really like to, again, have all of you have time to ask questions. But one of the things that some of you may have heard about is our desire to combine with Tufts to, again, develop efficiencies of scale. It will make us a bigger company. It will cover certain types of insurance that we don't cover. We cover some types of insurance they don't cover. They are a nonprofit carrier in Massachusetts. So that is ongoing. We'd expected to be able to announce, we'd hoped that we would have got approval this fall. COVID did affect that. I guess that's how I got to that. COVID did affect that. Department of Justice has been just a little busy. The Attorney Generals have been a little busy. The insurance departments have been busy. So we're hoping that first quarter of January, we'll be given approval for that. It's very complicated. We've been working really, really, really hard within the rules about two independent companies, and we are two independent companies. We're competing against each other in New Hampshire and Massachusetts and elsewhere. But we've been having teams with our antitrust lawyers there, making sure we talk about the things we can legally talk about, making sure that if we are given the go-ahead, that none of you, if you have Harvard Pilgrim Insurance, it won't miss a beat. You will not steal anything. It won't be a switch that's pulled. It's going to be a gradual merger of the two so as we just make decisions about what operating systems we'll use, what claim systems, all of that. So I've been on the teams, many of my staff from New Hampshire have been on the teams to talk about what New Hampshire needs to look like. and what some of the cool things are that we would like to do if we were big enough to do them. So you may hear more about that moving forward. I'm very hopeful. There's no guarantees, but hopefully with all the meetings we've had with the regulators, they'll agree with us that it's a good thing that we're combining as, again, two nonprofit companies. We're equal size, so it's not one assuming the other. We're both of about 1.2 million lives. We're both very financially strong, so if we don't combine, that's not a problem for either of us. But I think it does bring a lot to the table that just the size would allow us to do some things that we just haven't been able to do, that, you know, my bright ideas, some of my innovative ways of caring for people and working with providers. So I'm going to be quiet now, and again, hand it over to Kate, I guess, to find out if there's any questions. I hope there are, and I may have to get back to some of you if they're really hard questions, but hopefully I know most of them.
Yeah, and so definitely, thank you for that. Definitely use the Q&A feature. I have a question to start things off, at least. So sort of from a well-being perspective, you and I had talked on Friday, and I mentioned I had seen that sort of meme that was joking, instead of calling it working from home, we're going to call it living at work, right? And so when we talked on Friday, you talked a lot about, and I hadn't necessarily thought of it from this perspective, but that we've all sort of invited our workplace into our personal lives, right? That where there used to be boundaries, for many people, right? I mean, certainly there are folks that have always worked from home, but those maybe don't exist in the same way, right? People are working from their dining room tables, so they may not even have sort of a dedicated physical space. But what are do you have thoughts on long-term strategies to help with sort of individual well-being with this change?
Yeah, so I think one of the things that I lost, and it took me a while to realize that, was that separation you just talked about, that finite time where I sort of carve out time. I've always been an addicted to my phone person. It's my job. 24/7 I'm on. I've been that way as a physician, as a VP of the market. If a broker or a member has a problem and I need to figure it out, it doesn't make a difference what day it is. But now my poor wife is trying to not be seen behind me in the Zoom meeting, so I'm stressed about that. The vacuum cleaner going, the dogs barking. I was praying. My dogs were howling before I came on this call because mom had left the house, God forbid, and I'm upstairs out of sight. But what I've tried to do with our staff is, make sure they avail themselves of all the programs we have for stress reduction, whether it's the yoga, whether it's mindfulness, but also really, really, really make a conscious effort to carve out time for yourself and for your family. It's cute. I've seen everybody's cats. I've seen their dogs. I've seen their kids. I've seen the pictures behind them of their kids' artwork, the pack and play I have over my other shoulder over here for my grandchildren. When we first started out, it was novel, and I had everybody. We did kind of a Brady Bunch Zoom meeting. We took pictures and bragged about how cool our office was versus all the other offices, because we are the best. We're in New Hampshire. And it was kind of novel, but now it's not. And so I've really tried to say, look, the same way you promote our members getting mental health care, get mental health care. Avail yourself of our employee assistance program. We have a great, robust employee assistance program that a lot of companies in New Hampshire, we use the same one. But really take time to realize that your family deserves to have your full attention at different times. And you're not being a bad employee if you're not working constantly while you're at home. So I think it's just making a conscious, schedule some time to go for a walk, schedule some time for this. And we have that luxury. Yeah, you might have to work a little bit later, but at least your family got to see you while they were awake, before the kids went to bed. And I think we've really tried to be super flexible. We've been struggling with the return to the workplace. I used to say return to work, and we goes, what? I'm not working already? I mean, everybody's working. So it's not return to work, but return to the workplace. And right now, we're not planning to go back before January 1, because we seem to be doing okay without it. I do miss, and I know my staff misses, that in person. I mean, we have a great office. We work well together. We get along, we joke, we laugh. And I can't replace that, but we do have all staffs. I don't know if other companies are doing that, where we get on a Zoom meeting and we share stories. It isn't all about business. We've had some virtual gets-togethers. We just had a New Hampshire Service Day. We used to do a lot at the schools in Manchester with the Fisher Cats and the wild, monarchs and other people over the years. We just had one where we had our employees and their family putting together kits for people that are kids that are in the hospital. Ours this year was families in transition for moms who are going through recovery, who are living at one of the families in transition living apartments, and getting those kids the crayons, the activity kits, the other kinds of things. So we put those all together. We had sterile wipes to put it together. They're going to be quarantining them on Cape Cod, where they actually were sent back. But to just try to make things be as close to normal as you can, but at the same time, protect your life, and make sure that you also, that's what I've told people, it's okay to be a mom, be a spouse, but you need some time for yourself as well. I used to have time for myself when I drive home. Now I'm going 100 miles an hour, and then my wife starts asking me questions whenever I finally come out of my cubby, and I'm like, okay, I'm overwhelmed. And so I think finding time to sort of de-stress, listen to the radio, take a walk, and realize the stress that everybody's under. I think that I'm working as hard, and others are, probably a lot of you, as you were before, and with all the stress that's on top of that. I did want to stop for a second and just say, I talked a little bit briefly about my son who had gone through heroin addiction. We'd gone to Al-Anon, which I found very helpful. We'd done rehabs, we'd done all the stuff. So for any of you that are going through that, I sometimes feel guilty because it feels like bragging, but I did want to let you know there's a happy ending to that story, at least for us, that he lived through the overdose. Very, very sick, but got into Teen Challenge, which is in Manchester and other places around the country. And actually 7 years to the day from when he entered that residential program, he just started medical school this July 1st. So there is hope. I tell everybody, again, if you ever want to talk to me about it, ideas I have, resources, that kind of thing, but there is hope. But it is a huge issue. It's an issue for us as a payer, but it's an issue for us as parents. And I know a lot of you are struggling with that in amidst all of the other stuff, where a lot of these programs have had to shut down. There's so many restrictions about group therapy and other things. It's been a big stress on that. So hopefully we'll come out of this again, with other tools to help people who are going through that struggle as well.
For sure. Well, and so you mentioned not going back to the office until January, and earlier you mentioned a second wave being a concern. So sort of from, your medical life, can you talk a little bit about what you foresee? I mean, no crystal ball, of course.
Yeah.
But,
So I'm working on a couple of projects right now to help participate in vaccinating people once the COVID vaccine is available. I know there are a lot of new technologies to make vaccine faster than we've ever been able to make vaccines before. We're able to make vaccines to different parts of the virus that are probably going to confer longer lasting immunity and better immunity and maybe more universal immunity, even if the COVID virus changes, just like the flu virus changes every year, the COVID virus could change. So there's a lot of really cool technology. And there's a lot of politics around it, whether it's mask wearing or whatever. And I'm just kind of going, okay, all right, I get all that. But I think, I'm hopeful that sometime next year there will be enough vaccine available, enough of an approved vaccine available, and there'll probably be more than one, that people can start to get immunized that aren't just in the trials. I suspect, and maybe I could be wrong, I'll be happy if I'm wrong and it's sooner, but I'm thinking it's probably going to be June next year or more, before we really have widespread availability. And even when we have that, getting that vaccine done to that many people in the country is going to be tough. The first people that are going to get it will be the highest risk. So first responders, healthcare providers, elderly in nursing homes, other cancer, high risk patients will get it first. So it's going to be a while before all of us get it. And it's still so new that we don't know how long immunity people have. So we're still going to have to be careful. I would think, for another year or more, we're still going to be in the throes of being careful, distancing, masks, all the other pain in the neck stuff that we all have to go through to pump gas. I mean, it's just all these things you don't think about. But I think it's going to be a while before we really have a vaccine that's effective and readily available, and the capacity to get it to everybody, because not everybody can get it all at once.
Right. Well, and it's sort of, I mean, you said sort of a pain, but it's also in a lot of cases sort of second nature now, right? Like when when you do those things, you just sort of take those precautions. It's interesting to think about how quickly in some cases we can form these new habits.
Well, I can tell you, when I went to medical school, there was a lot of firsts for me. But one of the things was just how grossed out I get about bacteria and viruses being everywhere. And it freaked me out. I'm still a little bit of a OCD about, putting things down on a counter, washing my hands if I'm not sure if I washed them. And I'm not to be gross, but I told my staff, I said, you gotta keep remembering, wash your hands. I mean, all this mask and all the sanitizers on dirty hands aren't really that effective. You need to wash your hands whenever you can. There's times when you can't. But I tell everybody, if you wouldn't lick it and you touched it, wash your hands. Gas pumps, other kind of stuff. You just like, God, I would never lick that. Well, you touched it. And then I take my glasses off because I have allergies. You probably heard me sniffling throughout this, but I'm rubbing my nose or I'm doing this. That's all it takes. So it's simple, wash your hands. And if you're not sure, wash them again. It's going to be one of the big things.
Yeah, I remember early on when they came out with the happy birthday thing, finding a list of other songs so that you
Yeah.
didn't have to sing happy birthday, but there were other from this section to this section that you could sing instead.
It's funny how many things in medicine we put to songs. If you've ever done the single person CPR training, which I would recommend everybody do, because there's nothing more frustrating than seeing someone on the ground and not being able to do anything. But the song for that one was Staying Alive. So it's dum, 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 dum. That's how fast you're supposed to be doing CPR. So we have tons of acronyms in medicine, and now somebody's getting creative with songs in medicine. So yeah, if you have any others other than happy birthday, because I'm kind of tired of singing that, that would be great. If any of you have that, share it with me, please.
And it gets stuck for the rest of the day now. We'll all be singing to be here. Are there things you miss about being a doctor, like practicing?
Well, I practiced up until 2 years ago. So even the first 2 years I was VP, and as any of you in business know, there's a lot of functions. I mean, right after summer, the fall season kicks in, the fundraiser there's always networking. That was my job. Half of my job was to be out and sort of show we're human beings. We're not just the mean insurance company. Really try to get out there and show who we are as people. And so my weeks, like many of yours, don't just end on Friday at 5 o'clock. The day doesn't end at 5, and the weekends are full of golf tournaments and other kinds of things. So I don't want to imply that I'm a golfer. I am a horrible golfer, but so I think I actually practiced medicine at my old clinic on Saturdays until 2 years ago, when my wife threatened me. And she's from Brooklyn and she's Italian. I don't know if I told you that part either. So I don't mess with her. And so she had me stop. And I think it was one of the hardest things, one of the saddest things for me, because I really, really, really liked being a hands-on physician. And towards the end, I was seeing a lot of people I'd seen for 30 years or more. I know I look like I'm 20, but I've practiced medicine for a long time. And so I got to see multiple generations, just like my doc did when I grew up, that I loved about it. So I've seen grandkids of kids, that's how long I've been taking care of medicine. So I miss those stories. I miss sitting down with a patient, not just talking about diabetes, but talking about their family. And there's a certain amount of reward. I mean, you help people get better once in a while, not all the time, but you do help people get better. And it's just one of the biggest honors to be allowed to be a physician and hear the private stuff I've seen and poke and push. And so, yeah, I miss it immensely. Who knows, I might go back to it at some point, but I really do miss it a lot. It's the people, it's the stories. But I kind of get to do that here too. I get to meet a lot of people like you guys.
Yeah, well, it's certainly having a very broad impact, right, through your work. So that part of it is certainly continuing.
Yeah, and I get to have a clinical voice. It was one of the things I refused to join unless I knew, if I thought something made sense on paper, but it was a horrible idea for members or clinicians, we weren't going to do it. And I have I have guardrails, but I have the ability to speak up with a clinical voice. We have a lot of clinicians that work at Harvard Pilgrim. Like I said, it was started by physicians. So I do get to have my clinical input and use my clinical hat on a regular basis.
Good.
And and all of my staff that comes in and goes, I know you're not my doctor, but could you look at this? Is this serious? So I do kind of get to do it. I play one on TV now, so.
Yeah, that's great. So if there's anything that you could leave us with that you haven't talked about, or that maybe we don't know about Harvard Pilgrim or the health insurance industry, is there anything that you want to sort of leave the group with today?
Wash your hands. I think that's the one thing. But just that, we live here, we work here. We like to think that we're aware of what's going on because we are your neighbors and our members are our neighbors. A little bit of, that we don't just try to help people that are our members. We really want to be good citizens. And if you have an idea or a concern or whatever, you guys know how to get me. And I think that's one of the things that people like about us, that, again, we're people, we're available, we get the New Hampshire way.
Well, that's part of why we've done this series, right? To me, it's so fascinating to not just, see this person who's running this gigantic organization, but your person, right? It's nice to get to know those aspects and to, understand more about what makes people who they are.
Well, it's so nice of you to have asked me, and an honor. And thank you for letting me chat.
Thank you for being here. And thanks to all of you who joined us this afternoon. Have a great rest of your Monday, and we'll talk to you soon. Thanks,
Everyone. Appreciate it. Bye.